African Medical Research Council has appealed for people to avoid indoor gatherings due to the high transmissibility of the new COVID-19 Omicron variant. With more than 16,000 new COVID-19 cases that were recorded in the last reporting cycle, South Africa has passed another grim pandemic milestone with more than 3 million infections across the country. Dr. Fareed Abdullah, Infectious Diseases Clinician at Steve Biko Hospital and the Director of the Office of AIDS and TB Research at the South African Medical Research Council, joins me now. A very good afternoon to you, Doc. Thanks indeed for your time. So, from what we know, are the virus infections in this, as we head towards this fourth wave, faster than the previous waves?
So it seems like that. It certainly seems like that. If you compare the rate of increase of the number of infections in Gauteng compared to previous waves, and you superimpose them, it's clearly going up much faster than previously.
Talking about Gauteng, I mean, it being the epicenter, what are we witnessing in terms of the hospitals with regard to this new variant? Because in previous waves, many of those being hospitalized needed your supplemental oxygen. What are we seeing now with those who are being admitted to different facilities?
So we're seeing a slightly different picture from previous waves in that the patients in the COVID wards many of them are not on oxygen. They are there for other medical reasons. They should be in the hospital for medical or surgical reasons, but their COVID infection is what I would call an incidental COVID infection. So 2/3 of the patients in the wards on Thursday last week, which is the day we looked at 42 patients, were on room air. They were breathing normally. Let me say a few more things about this, if that's okay. So the first difference we've noticed from previous waves is the age breakdown is definitely different.
Yes.
So more than 80% of patients in the wards since this wave broke out are under the age of 50. So it's a much younger population. 28% of those, a whopping 28%, were between the ages of 30 and 39, and 19% were children from 0 to 9. But the main thing really that we want to say is that these patients, 66% or 2/3, are what I would call incidental COVID. They're on room air. That's not to say that COVID is not causing disease. It still is causing disease in a small proportion of people who are in the hospital for it, and it's still a serious disease to be taken seriously. But the picture is different from previous waves. In previous waves, the COVID wards had 90%, 95% of the patients were on some form of oxygen, some requiring a lot of oxygen, and the picture is certainly different. Now, that might be like the first few weeks of the epidemic, and it'll change, but that's what we're seeing now.
Yeah, let's talk about the clinical status of vaccinated people. Are we able to say, from what we're seeing now, those who have been vaccinated are presenting milder symptoms? Can we draw that inference currently?
So there's a lot of evidence now coming out of this country and other countries in the world that vaccinations are protecting for severe disease. Groote Hospital has shown that most of their severe COVID pneumonias are in unvaccinated people. In our small sample at the Steve Biko Tshwane District Hospital Complex, of the 9 patients with COVID pneumonia, all 9 were unvaccinated people.
All right, that certainly gives us a bit of an indication. But I want to go back to what you spoke about. I know also at the Chris Hani Baragwanath Hospital, we had a guest from the ICU yesterday, the head of the intensive care unit at Chris Hani Baragwanath Hospital. And exactly what you speak about is seeing younger age groups that are now needing hospitalization. I mean, those 12 and under are not yet eligible for vaccination. I mean, should government be speeding up the process to get those vaccinated in light of what we're seeing in some of these facilities now?
So I'm not really an expert on whether children under 12 should be vaccinated. That's the international trend, and that's certainly coming down the pike in this country. You know, Professor Murray, Professor Gray, these are the experts who can kind of guide government on that. What I'd like to say is that in the younger adult population, there's clearly a problem with unvaccinated people. So in Gauteng, the over 50s, 57% are vaccinated, but only 34% in the age group 18 to 49 are vaccinated. And that's perhaps why we are seeing so many younger adults in these wards in this wave, and fewer older people.
Perhaps I'd also just like to get your view lastly, Dr. Abdullah. I mean, we're heading towards the festive season. We've seen an increase in the number of COVID-19 cases over the past few days. 16,000 yesterday in that last reporting cycle. The previous day was slightly over 11,000. Would you advise, as the South African Medical Research Council, that government perhaps put stringent measures in place to ensure that perhaps when everyone returns from the holidays in January, we're not sitting with a crisis, in particular in places like Gauteng, which is already the epicenter, and most people will be returning to after the holidays?
So my overall instincts, Griselda, are that government has really got it right this time to limit regulation, not to put in too many restrictions, but I think there's still a responsibility on all of us to reduce our indoor gatherings. I have just cancelled 3 family gatherings this weekend because I just think it's too risky. I wouldn't feel safe going into little groups of family meetings indoors, and the weather has been, inclement in Pretoria this weekend, so we've only been able to meet indoors. I think people must take it upon themselves to reduce their indoor gatherings, because this is clearly a highly contagious variant, and, it's spreading very fast. And if you don't want to get infected, then really take your lives into your own hands and reduce the indoor gatherings and do the other things, which are mask wearing and social distancing.
Dr. Fareed Abdullah, Infectious Diseases Clinician at the Steve Biko Hospital and the Director of the Office of AIDS and TB Research at the South African Medical Research Council. Thank you very much for joining us on the program. Speaking about that inclement weather, let's take a look at what's happening in your part of the country. A bit chilly here in Johannesburg and a bit rainy as well this afternoon.